Steve Bullock is announcing a new initiative to improve health outcomes in the state. The plan outlines a series of strategies looking to address some of the state's biggest health and safety concerns, ranging from smoking to motor vehicle fatalities. Capitol reporter Dan Boyce says many of these strategies still involve a fair amount of personal responsibility from citizens.
Department of Public Health and Human Services Director Richard Opper estimates his staff has been working on compiling the information for this new initiative for more than a year. It shows cardiovascular diseases and cancer jointly accounting for about half of all deaths in Montana. Tobacco use remains the single most preventable cause of death, and increasing obesity rates are leading to a growing epidemic of diabetes in the state. Opper says his department's job is to look for ways to lower those stats and improve the delivery of health care.
One of the best ways to do that is to come up with a plan, figure out what the exact status of the health of the citizens of the state is. What percentage of smokers do we have? What percentage of pregnant women smoke? Obesity statistics.
And that plan is called Big Sky, New Horizons, A Healthier Montana. Governor Steve Bullock unveiled it during a meeting of the Montana Association of Public Health Officials.
When it comes to health care, we will and we have and will continue to have grand policy debates about who pays and how much they should pay. But what we shouldn't lose sight of is there's so much that we can do.
And what this plan outlines are things the administration can do without the approval of the legislature. It lays out 6 major priorities ranging from preventing chronic conditions to reducing substance abuse. And then 78 different strategies are identified to achieve those goals. These are things like promoting the implementation of tobacco-free school campuses all the way to improving electronic health records. DPHHS Director Opper says the department will be looking at almost 30 different health indicators to track the program's progress. He says the department is setting benchmarks to reach specific goals, but he acknowledges most of these goals require citizens comply with the state's health recommendations and take their own initiative.
We don't have the ability to necessarily enforce what are unquestionably good ideas on people. So there are educational programs that we can undertake and enhance that will at least give people better tools to make better decisions in the future.
Opper says many of these programs are already underway, others are still in the implementation process. DPHHS worked on preparing the Big Sky New Horizons health plan with the help of more than 130 different organizations. I'm Dan Boyce reporting at the Capitol.